Are you over 70 and being told you need medical tests that could actually do more harm than good? In the next 15 minutes, you'll discover 5 common medical procedures that leading hospitals across America say seniors should seriously reconsider, and exactly what questions to ask your doctor instead. Here's something most people don't know. One of these tests was quietly removed from standard recommendations by major medical organizations, yet thousands of doctors still order it every single day for patients just like you. Barbara, a vibrant 74-year-old from Arizona, walked into her doctor's office feeling perfectly healthy. Her physician recommended a routine screening test, assuring her it was standard protocol for someone her age. That single test triggered a cascade of follow-up procedures, biopsies, sleepless nights filled with anxiety, and complications that landed her in the hospital for a week, all for a condition that medical experts now say would never have threatened her life or health. Test 1. Routine colonoscopy. After age 75. Your doctor schedules another colonoscopy appointment, and you assume it's just something you have to do. But here's what the medical community wants you to know. If you're over 75 and have had normal colonoscopies in the past, continuing routine screening may expose you to serious risks without meaningful benefits. The U.S. Preventive Services Task Force, which sets national screening guidelines, specifically states that the decision to screen for colorectal cancer in adults aged 76 to 85 years should be an individual one, and routine screening is not recommended for most people over 75 who have been previously screened. This isn't just one doctor's opinion. It's based on careful analysis of risks versus benefits in older adults. The reasoning behind this guideline is straightforward and important for you to understand. Colonoscopies require sedation, which carries increased risks as we age, including respiratory complications and adverse reactions to anesthesia. The procedure itself can cause bowel perforation, bleeding, and infection, complications that become more dangerous and harder to recover from after age 75. Meanwhile, if you've had normal screenings throughout your life, the chance of developing colorectal cancer that would actually threaten your life in your remaining years becomes extremely small. Most colorectal cancers grow slowly over many years, and finding one after 75 often leads to treatments that are more harmful than the disease itself would have been. Research from the American Cancer Society shows that people over 75 with no history of polyps or cancer and who have had regular negative screenings receive minimal benefit from continued colonoscopies. Kenneth, a 77-year-old from Michigan, insisted on his scheduled colonoscopy despite having had 3 normal exams over the past 15 years. During the procedure, he experienced a bowel perforation that required emergency surgery, a month-long recovery, and permanent changes to his digestive health. His gastroenterologist later admitted that given Kenneth's screening history and overall health, the test had been unnecessary. The real tragedy is that Kenneth thought he was being responsible by following through with the screening, when in fact he was exposing himself to preventable danger. Here's what you need to do today. Before you schedule or attend another colonoscopy, sit down with your doctor and have an honest conversation about your personal screening history. Ask these specific questions. What were the results of my previous colonoscopies? Given my age and past results, what are the actual risks versus benefits of another screening? What complications could occur, and how would they affect my quality of life? If your doctor recommends proceeding, ask them to explain exactly why your individual situation calls for continued screening. In most cases, if you're over 75 with a history of normal exams, stopping routine colonoscopies is the medically appropriate choice. Don't wait until you're in the procedure room to have this conversation. Call your doctor's office this week and request a pre-screening consultation. Test 2. Annual mammograms after age 75 without risk factors. You receive your annual reminder card for a mammogram, and you dutifully schedule the appointment because that's what you've always done. But medical guidelines have evolved, and continuing routine mammography after age 75, when you have no symptoms, no family history of breast cancer, and no genetic risk factors, may cause more harm than good. The American Cancer Society updated their guidelines to reflect current research, showing that for women over 75 with average risk and no symptoms, the benefits of routine screening decrease significantly while the harms increase. These guidelines aren't suggesting that older women don't matter. They're based on solid evidence about what actually helps and what actually hurts women in this age group. The science behind this recommendation is clear and worth understanding. Mammograms become less accurate as breast tissue changes with age, leading to higher rates of false positives, abnormal results that turn out to be nothing serious. False positives lead to additional imaging, biopsies, anxiety, and sometimes unnecessary treatment for cancers that grow so slowly they would never have caused problems in your lifetime. Johns Hopkins researchers found that 1 in 4 mammograms in women over 75 produces a false positive result, subjecting women to invasive follow-up procedures that ultimately find nothing dangerous. Additionally, breast cancers detected in women over 75 are often slow-growing types that wouldn't become life-threatening, yet their detection leads to surgery, potential complications, and treatments that genuinely reduce quality of life without extending it. Gloria from Pennsylvania continued annual mammograms until age 78, when one showed a suspicious area. She underwent 2 additional mammograms, an ultrasound, and finally a biopsy that showed atypical cells. Not cancer, but worrisome enough to require close monitoring. For 18 months, Gloria lived with constant anxiety, underwent repeated imaging, and eventually had a lumpectomy for something that 3 pathologists later agreed would never have progressed to invasive cancer. Her daughter, a nurse, wishes she had known to question whether annual screening was truly necessary for her mother at that age. Take action on this information right now by reviewing your personal risk factors honestly with your doctor. Schedule a consultation specifically to discuss whether you should continue mammograms, reduce their frequency to every 2 years, or stop routine screening altogether. Ask your doctor, do I have any risk factors that justify continued screening at my age? What is my realistic life expectancy based on my overall health? If we find something, would I be healthy enough for treatment? And would treatment genuinely improve my life? These aren't morbid questions. They're responsible questions that help you avoid unnecessary medical interventions. If you have no family history, no symptoms like lumps or discharge, and no genetic factors like BRCA mutations, stopping routine mammograms after 75 is often the wisest choice. Call your doctor before your next scheduled mammogram to have this discussion. Test 3, PSA testing for prostate cancer after age 70. If you're a man over 70, that routine PSA blood test your doctor orders at every physical might be doing more harm than good. The US Preventive Services Task Force recommends against PSA screening for prostate cancer in men aged 70 and older, and the American Urological Association agrees that routine screening should generally stop at age 70 for men with average risk. This recommendation comes from years of research showing that PSA testing in older men leads to the detection of prostate cancers that would never cause symptoms or shorten life, while the treatments for these cancers cause very real and serious side effects. This isn't about giving up on men's health. It's about protecting older men from unnecessary harm. Understanding why this matters requires knowing how prostate cancer behaves. Most prostate cancers grow extremely slowly, taking 10 to 15 years or more to become dangerous. If you're 70 or older and a slow-growing prostate cancer is detected, there's a very high probability that you'll die of something else entirely before that cancer ever causes problems. However, once cancer is detected, The medical system typically pushes toward treatment, surgery or radiation, both of which carry significant risks of incontinence and erectile dysfunction. Research published by the Mayo Clinic shows that men over 70 who undergo PSA screening have a higher chance of experiencing harm from follow-up procedures and treatments than of benefiting from early cancer detection. The test itself is also unreliable. Elevated PSA levels can be caused by benign prostate enlargement, infection, or even bicycle riding, leading to unnecessary biopsies that carry risks of serious infection and bleeding. Walter, a healthy 72-year-old from Texas, had an elevated PSA during his annual physical. His doctor ordered a prostate biopsy, which came back showing a small area of very low-grade cancer. Walter underwent surgery to remove his prostate, resulting in permanent incontinence that requires him to wear pads daily and complete loss of sexual function. 2 years later, a different urologist told Walter that his cancer was so slow-growing and low-grade that it almost certainly would never have caused him any problems in his lifetime. Walter wishes someone had told him he could have simply monitored his PSA levels or avoided the test altogether. Here's your action plan. Before your next physical examination, prepare specific questions for your doctor about PSA testing. Ask directly, why are you ordering this test for me at my age? What will you do differently based on the results? If cancer is found, would you recommend treatment? And am I healthy enough to undergo that treatment? What are my realistic chances of dying from prostate cancer versus dying with prostate cancer that never bothers me? Unless you have specific symptoms like difficulty urinating, blood in urine, or bone pain, declining routine PSA testing after age 70 is medically sound. If your doctor insists the test is necessary, ask them to explain how their recommendation differs from the U.S. Preventive Services Task Force guidelines and consider seeking a second opinion. Make this decision before your next blood draw, not after you're already facing an elevated PSA result and the cascade of interventions that often follows. Test 4. Aggressive cardiac stress testing in asymptomatic patients. You're scheduled for a cardiac stress test or advanced heart imaging, even though you feel perfectly fine, have no chest pain, no shortness of breath, and no unusual fatigue. This scenario happens frequently to older adults, but the American College of Cardiology and the American Heart Association both caution against routine cardiac screening in people without symptoms. Stress tests and cardiac imaging in asymptomatic patients often detect abnormalities that lead to more invasive testing and procedures. Yet research shows these interventions don't improve outcomes for people who weren't having symptoms in the first place. Major medical centers like the Cleveland Clinic have published guidelines specifically warning against this type of routine screening because the risks of the follow-up procedures often outweigh any potential benefits. The problem with screening healthy hearts is that these tests frequently produce false positive results or identify minor abnormalities that would never cause problems. A stress test might show reduced blood flow to part of your heart, leading your doctor to order a cardiac catheterization, a procedure where catheters are threaded through your arteries to your heart. Cardiac catheterization carries real risks, including arterial damage, heart attack, stroke, kidney damage from contrast dye, and bleeding complications. If the catheterization shows narrowed arteries, you might be pressured into having stents placed or even bypass surgery. Yet multiple large studies, including research from Stanford Medical Center, have shown that in people without symptoms, these procedures don't prevent heart attacks or extend life compared to medication and lifestyle changes alone. You undergo real risks and recovery periods for procedures that provide no meaningful benefit. Diane, age 71, from Florida, saw a new doctor who ordered a stress test as part of a comprehensive physical, even though Diane had no complaints. The test showed an abnormal pattern, leading to a cardiac catheterization that revealed moderate narrowing in two arteries. She received 2 stents and experienced a complication during the procedure that required an extended hospital stay. 1 year later, after reading about appropriate use criteria for cardiac testing, Diane's cardiologist acknowledged that without symptoms, the testing cascade never should have started. She now lives with anxiety about her heart and takes multiple medications, all stemming from a test she never needed in the first place. Take control of this situation by asking pointed questions before any cardiac testing is scheduled. When your doctor orders a stress test or cardiac imaging, immediately ask, "What symptoms am I having that justify this test? What will you do differently based on the results? If we find something, what are my treatment options and their risks? How will those treatments improve my life or longevity, given that I'm not having any symptoms?" Tell your doctor clearly if you're not experiencing chest pain, unusual shortness of breath, dizziness, or excessive fatigue with normal activities. If you're symptom-free, declining routine cardiac screening is appropriate and aligns with current medical guidelines. Don't let yourself be scheduled for these tests simply because they're available or because the doctor wants to be thorough. Question the necessity before you're on the treadmill or in the imaging machine. Test 5. Frequent bone density scans after years of treatment. You've been treated for osteoporosis or low bone density for several years, and your doctor continues to order bone density scans annually. While monitoring bone health is important, annual DEXA scans after you're on stable treatment rarely change your medical management and subject you to unnecessary radiation exposure and expense. The National Osteoporosis Foundation and guidelines from Harvard Medical School indicate that once you're on stable osteoporosis treatment with no fractures, repeat bone density testing every 2 to 3 years is sufficient for most patients. Some patients on long-term stable treatment may not need testing more frequently than every 5 years. More frequent testing doesn't improve outcomes. Bone density changes very slowly, and measurements from year to year often fall within the margin of error of the test itself. The reasoning is straightforward when you understand how bone density testing works and what it tells your doctor. DEXA scans measure bone mineral density with a certain degree of variability. Small changes from year to year usually reflect testing variability rather than real changes in your bone density. If you're taking your prescribed treatment consistently, not experiencing fractures, and your overall health is stable, annual scans provide no new information that would change your treatment plan. Meanwhile, although DEXA scans use lower radiation than regular X-rays, repeated exposure adds up over time. Research from the Mayo Clinic confirms that extending the interval between bone density tests in patients on stable therapy is safe and appropriate. The goal of osteoporosis treatment is preventing fractures, and treatment decisions should be based on your overall fracture risk, history, and response to therapy, not on minimal fluctuations in bone density measurements. Joyce from Ohio had been taking prescribed treatment for osteoporosis for 8 years with excellent adherence and no fractures. Her doctor ordered annual DEXA scans, each showing minor variations that were statistically insignificant. After Joyce moved and established care with a new physician, the doctor reviewed her records and explained that given her stable treatment and lack of fractures, testing every 3 years would be medically appropriate and would provide just as much useful information as annual testing. Joyce realized she'd undergone 5 unnecessary scans over the years, exposing herself to preventable radiation and spending money on tests that provided no benefit to her care. Act on this information by reviewing your bone health testing schedule with your doctor at your next appointment. Bring a list of all bone density scans you've had and the results of each. Ask these specific questions. How long have I been on stable treatment? Have my scans shown significant changes that altered my treatment? Based on current guidelines, how frequently do I actually need bone density testing? Could we safely extend the interval between tests? If you've been on stable treatment for several years without fractures and your last several scans showed stable bone density, request that testing be done every 2 to 3 years instead of annually. This simple change reduces radiation exposure, saves money, and follows evidence-based medicine without compromising your care. Don't wait. Make a note to discuss this at your next appointment, or call your doctor's office to address it before your next scheduled scan. The medical landscape has changed significantly in recent years, with major health organizations recognizing that more testing isn't always better, especially for older adults. The 5 tests we've discussed: colonoscopies after 75, annual mammograms without risk factors, PSA screening after 70, cardiac stress testing without symptoms, and frequent bone density scans, represent common scenarios where routine testing can cause genuine harm without providing meaningful benefits. Taking charge of your healthcare means asking thoughtful questions and making informed decisions with your doctor, rather than automatically accepting every test that's offered. These conversations protect you from unnecessary procedures, reduce your exposure to medical risks, and allow you to focus on interventions that truly improve your health and quality of life. Which of these tests have you been told you need recently? Share your experience in the comments below. Your story could help hundreds of other seniors navigate these same decisions with their own doctors. If this information gave you valuable knowledge and confidence to advocate for yourself, click the like button and subscribe to this channel so you never miss health information specifically designed for our generation. Right now, share this video with your friends over 70, especially those who have annual physicals or regular doctor visits coming up soon. This information could spare someone you care about from an unnecessary procedure and its complications. Knowledge truly is power when it comes to making smart healthcare decisions at our age.